Now let's go ahead and look at the ulna itself, and we'll start with the trochlear notch. The trochlear notch is going to sit inside of the hourglass-shaped trochlea on the humerus. Just to the lateral side of the trochlea notch, we are going to have the radial notch. The radial notch is going to be the articulation point between the proximal head of the radius and the ulna. We have the lateral edge, which is going to be the area that the interosseous membrane is going to go ahead and border on. We have the ulnar styloid at the very distal edge of it. And at the very proximal edge of it, we have the olecranon process. We have two distinct head and neck areas of the ulna as well as of the radius. The proximal head and neck will be the articulation point at the elbow. And the distal head and neck will be the medial side of the carpal region or of the wrist. On the radius, we're going to have that proximal head as well as the distal head. On the radius, we're going to have the ulnar notch. The ulnar notch is going to be the articulation point for the radius on the ulna. And this is at the proximal head and at the notches. This allows for supination and pronation to take place as the radius will be rotating around the ulna in the process of pronation and supination. We have the radial tuberosity. We have the medial or the interosseous edge. The interosseous edge is the junction point of the interosseous membranes that will be holding both the radius and the ulna together in place, allowing for the radius to move around the ulna without the bone separating. We see the same thing between the tibia and the fibula in the lower extremity. However, in the lower extremity, it's a slightly more robust set of dense regular connective tissue in that area that keeps the bones more intact so as to allow for proper weight-bearing maintenance. On the distal edge, we'll see the radial styloid. The radial styloid you can find at the proximal junction point of the thumb side or the pollice side of the hand. And it's important to be able to find this styloid because that is where you will find the radial pulse when you have to take a radial pulse on somebody. So we're going to flip over here and look at the posterior side. And on the posterior side, we see that olecranon process more pronounced. And we see the ulnar styloid becoming more pronounced on the posterior side of the ulna. We still have our proximal heads and our distal heads for both the ulna as well as the radius. We will see the radial styloid, and we will see a more pronounced distal ulnar notch. And so once again, the notches is what's going to allow for that rotation to take place in a pseudo-pivot articulation in between the radius and the ulna. Now we say it's a pseudo-pivot because it actually behaves more like a gliding joint in terms of the way in which the bones interact around each other. However, the motion that takes place is strictly rotation, which is why it can be classified as a pivot as well. And so this is going to take us now down into the wrist and into the hand. And so the first bones that we're going to look at when we look at the wrist and the hand are the carpal bones. The carpal bones are arranged in a double row, so it's a stacked set of bones in two sets of rows that are held together in an archal form by what's referred to as the carpal ligaments. And there are two tunnels within these carpal ligaments. There is the dicuvane tunnel to the digiti minimi side, and there is the carpal tunnel, which is going to be across the middle region of the carpal bones. So the first carpal bone that we're going to see is going to be articulating with the radius, and that is the scaphoid. And then we get the carpal bone that will be articulating onto the ulnar side, which is the lunate. Also on the ulnar side, we will get the triquetrum, and then a small little bone that sits on top of the triquetrum, and that is the pisiform. Medial to triquetrum and pisiform and distal to lunate, we get the hamate. And one of the prominent features on the hamate is a small little hook, which is referred to as the hook of the hamate. And that is one of the connection points for the carpal ligament, forming the carpal tunnel roof. We then get to the largest of the carpal bones, that is the capitate. And then we get to the trapezoid, and then the trapezium. Now, what's important here to understand as it relates to possible injury to the carpals is that damage on the trapezium and on the scaphoid are very hard to actually heal and typically leads to some sort of bone necrosis to the bones because vasculature actually flows around those bones as opposed to flowing through those bones. There's very little nutrient arteries going into those two bones, which is why any carpal injury, any wrist injury to the polys side, to the thumb, can lead to necrosis of those bones if we do not treat and brace that area correctly. Distal to the carpals, we get the metacarpals, and the metacarpals are going to be numbered 1 through 5, where the first is polys, that's the thumb. The second is indices, your index finger. The third is media, the middle finger. Fourth is cardia, your ring finger. And fifth is minimi, M-I-N-I-M-I, and that is your pinky. Distal to the metacarpals, we get the phalanges, and the phalanges are simply indicated as whether they are proximal, closest to the metacarpals, or distal, furthest from the metacarpals. For digital rays 2, 3, 4, and 5, there is a third phalange within that, and that is the middle phalange. The first digit, polys, only has 2 phalanges in it, whereas all other digits will have 3 phalanges. So this is the hand and wrist on the palmar side, but let's take a look at it from the dorsal side. And so on the dorsal side, we have the scaphoid, and we have the lunate. We have triquetrum. Now notice we're going to miss one here. We lose the pisiform on this viewpoint, but we still see the hamate. We still see capitate. We still see trapezoid. We still see trapezium. We have our metacarpals. And notice how the numbers have flipped in terms of the order that we saw because we've turned the hand over. We've gone from a supinated hand position to a pronated hand position. We still have our proximal, our middle, and our distal phalanges. And so there are the bones of the upper extremities with their important landmarks.